Hello, everyone. My name is Trenton Ribbons, and today I'm going to tell you about federated learning in a healthcare setting. Basically, the goal of federated learning is to be able to combine insights and model weights in a way where the data isn't centralized. So, a more detailed definition is federated learning is a learning paradigm in which multiple parties train collaboratively without the need to exchange or centralize data sets. So basically, instead of sharing all the data, you're just sharing the model weights um, between parties. So here's one option for the workflow. It's the aggregation server, where basically you start with the global model that you distribute to the local participants. They train it with their data, and then they send just the gradients and weights to that central server. It then aggregates those, and then you repeat the process until the training's done. The other option is called peer-to-peer, and basically you start by synchronizing the models. You train them with local data, and then every participant shares their weights and gradients with the other participants. They're then aggregated and synchronized again. So the benefits in healthcare. So one of the main benefits is you get more data. So with machine learning type applications, as we know, the more data you have, the better the models can potentially be. So, especially in rare cases where the clinician may only see a handful of cases in their lifetime, this additional data from different participants is really helpful. It also really helps reduce bias because, clinicians are going to have a bias based on what they've seen, and that's going to vary based on the demographics of the populations they serve as well as geography. So this type of approach of federated learning helps improve the consistency across uh, hospitals and practices. And finally, it allows the patient data to remain with the hospitals and practices, which is important not only for patient privacy, but also sometimes data is proprietary. So hospitals and practices are reluctant to share that. So here's a real world example. During COVID, NVIDIA teamed up with 20 hospitals and they wanted to create an AI model to predict oxygen needs of COVID-19 admits in emergency rooms. So the ICU had very limited beds and respirators were at relatively limited during COVID. So it was vital that they could determine which patients were most likely to need additional oxygen. So they use X-ray data, patient vitals, and lab values um, to predict the oxygen demand, and they got to 0.94 area under the curve in just 20 days. So the neural net used ResNet 34 as kind of the foundation, and the output of the model was basically under observation or intensive care. Finally, as far as challenges and looking ahead, these models can be susceptible to reconstruction attacks, where basically the private patient data can be reverse engineered just from the model parameters and weights. There's also the challenge of you have a lot of different participants, so ensuring all the data is of a high quality and the format is consistent is really challenging. You need to have a consistent framework up front, and you also really don't have a way to check and verify this. And the last challenge is large institutions that have quite a bit of data already. There is not as much incentive for them to participate, but these types of models benefit. The more participants, the better the model. So looking ahead, really, one of the big things is figuring out ways to keep the privacy um, and prevent reconstruction, and also come up with consistent frameworks and agreements for sharing data in these types of formats for federated learning. And those are my references. So thank you. I hope you learned more about federated learning.